The BMJ's strategy has four main pillars: to increase our reach, our impact, our influence, and also to make enough money to support what we do.
The BMJ's print journal is currently sent to over 100,000 doctors up and down the country. It's not only BMJ's most prominent product, but also one of the major benefits of BMA membership. But we're undoubtedly working in a challenging environment. People are reading print publications less and less, and doctors are no exception to that. We had a major redesign 2.5 years ago, and this time last year launched an update to that design. So the latest JICMARS figures show that while our competitors have lost readers or have ceased publishing altogether, the BMJ's managed to hold on to its readers and stop the decline that had been continuing over a few years. We're now working with CoLab to see how we can further improve the print journal. We're keen to hear firsthand about the day-to-day challenges that GPs face and what we can do to help them. We'll then use that knowledge to help overhaul some of the formats we currently produce and to develop new formats that better meet the needs of busy working GPs.
Our content has reached more people than ever through bmj.com this year. This was helped by improvements we've made to the website, but mainly through some incredibly popular content we published earlier in the year. So the next steps are for us to find out more about these new users so we can better serve their needs, and in turn how this can support new and existing revenue streams. We're also looking to further our reach by launching a new app later this year.
Yeah, the impact factor is a bit of a controversial thing, and it doesn't measure what it needs to measure, but the essential thing of the impact factor is that it is the single factor that drives submission. Keeping that in mind, we have been trying over the last 5 years to increase our impact factor by giving more attention to citability of papers that we are going to accept. And we have been relatively successful because the impact factor has gone up from around 12, 13, 6 years ago to almost 21 in 2017. And we got 6 papers in the top 100 of Altmetrics, I think, which is quite good. The number one paper was the paper about active commuting, decreasing your risk for cardiovascular disease, which was one of the large UK biobank studies.
And can I encourage her to look at the article in this week's British Medical Journal, which clearly sets out the evidence, the growing evidence, for the benefits of active commuting, particularly by bicycle.
So one of our KPIs is to generate media coverage, and we do this by press releasing content from the journal every week. In 2017, we press released over 120 items of content from the journal. They tend to be topics of interest to most people, so things like pregnancy, diet, education, unborn babies, and some of the top articles that made mass media coverage in 2017 included the health benefits of coffee, the risks of traffic pollution to unborn babies, benefits of exercise, and the link between obesity and cancer. So we have several what we call KPI outlets. So these are top-tier media outlets throughout the world. They include things like the BBC, the New York Times, the Sydney Morning Herald, and the Times of India. In 2017, we actually got record numbers of mentions in those outlets.
The BMJ has almost 300,000 followers on Twitter, and we post content there around the clock 7 days a week. For example, in a recent What Your Patient Thinking Is article, we had a flood of responses from readers. The article was talking about how, as a patient, the author had had a lot of operations as a child. She talks about how doctors were always calling her brave, but actually this just made her feel worse, because often it made her feel as if it was wrong to cry or feel scared. The doctors got in touch with us to say things like, "I've been guilty of doing this, but learning to do better. This has given me lots to think about. This is something for all paediatricians to take on board, and this is a really important read for doctors." So one of our KPIs is to influence doctors' practice, but that can be really hard to measure. But with this kind of feedback, it's a small insight into how we are helping doctors change their practice and make care more patient-centred.
So unlike other journals, the BMJ is a campaigning journal, and we've been working with an external consultant to think about how campaigns fit within the editorial work of the journal. And so this year we've decided to focus on 4.
One of the 4 campaigns that we're going to be working on this year is Doctors' Wellbeing. Following the Junior Doctors contract dispute and also the case of Hesida Bawagaba this year, we realised that doctors are under severe pressure and morale is low among the workforce. Currently we're looking at recruiting an editorial board, so look out for the work that we're doing over the next 6 months or so.
I believe the Open Data campaign was a major success. It made evident that the evidence base for many drugs is not open to independent scrutiny. And it also spurred many positive changes in the access to data landscape. But it's become clear that the process is not moving swiftly enough, and there are still major barriers that prevent access to clinical trial data. So we've decided to reinvigorate the campaign, and we're launching the effort focusing on statins and HPV vaccines. In both of these, we have major public health interventions, yet also a degree of controversy and public concern. And so we think we have a strong case to demand access to data to support an independent evaluation.
So a short update on the patient partnership strategy. Some of the things that we're currently working on is some revised guidance for the education section on all the different ways in which you can co-produce and involve patients in writing education articles. We've also got a webinar coming up this week, which is sharing some of the experience of the panel members and the state of patient partnership in Southeast Asia. So looking more internationally, we've had a couple of successful Twitter chats already this year, and we've got a few more coming on the topics of patient involvement in conferences and things like that.
So in recognition of the 70th anniversary of the NHS, we're running a series of articles which will look at the future of the NHS and provision of universal healthcare. We will address questions such as what is the scope of the NHS, how do we know if it's got enough money, how will big data affect the provision of healthcare in the years to come.
So how do we do new things when our revenues are fairly flat? Well, first of all, we control our costs, and that's a full team effort. Then we look at how we can grow some new revenues, both from our collections, from our increased digital usage that Isaac's told you about. We also want to focus on the future and things that don't necessarily have revenue yet, and one of those is preprints, which are a way for researchers to share things ahead of formal journal publication. And we're working with the founders of a biology preprint archive to help set one up for clinical medicine.
BMJ Rapid Recommendations is a cross-group project involving BMJ Editorial, Open, Best Practice and Heart so far. Together we're working with MAGIC, an external organisation, to do better and faster guidelines for practice. Sometimes guidelines can take years to get into practice, or they can be produced in an untrustworthy way. We're trying to work to produce a state-of-the-art package that includes a systematic review and a guideline product in one. The project involves 2 of our most important values: true partnership with patients and independence from commercial influence. We've only just started, and this is a pilot project, but the articles are proving some of our most successful education pieces online.
So the BMJ has a growing collections programme, and that really enables us to do a deep dive into topics that we can't always cover in the day-to-day running of the journal. And it also enables us to partner with important organisations such as the WHO and the Health Foundation.
Hello from Mumbai. Last year we published a collection of articles on health in South Asia, where we offered the BMJ platform to leading health experts to identify key health priorities in the region. And I think it was landmark. It was landmark because although the socio-cultural context in South Asia is quite similar and the health issues and health systems are quite similar, there are political barriers that prevent academics, scientists, public health professionals from across countries to come together to foster collaborations and to learn from each other's work. And so through the collection, we managed to do that. The collection received widespread media coverage, and we had a fantastic launch meeting.
This February, the BMJ launched the first China collection called Medical Research in China. It got a wonderful media coverage, and I received many positive feedbacks from readers and the research community. This collection helped the BMJ to promote its influence and increase visibility in China, and it also drive the BMJ to achieve its long-term goal and continue to play an important role in changing healthcare in China.
We really do aim to change the culture of healthcare for the better and to help create a healthier world. And we want to do that across the company. So if there's anything you've seen in this video that interests you and you'd like to work more closely with the BMJ, please do get in touch.